again, a warm welcome to everyone. So thank you very much for joining us for the session titled NCDs and Health Security, Strategic Pathways and Investments to Get Back on Track for 2030, co-hosted by the NCD Alliance, the World Health Organization, and the Lancet. My name is Roman, for those who don't speak French, and I will be your technical facilitator for today. For assistance, please use the chat function to message anyone, including me, with the title Technical Facilitator in their name. Before we get started, I have a few technical notes to explain. Interpretation, as you may have noticed, is available in French and Spanish. You can find the interpretation button at the bottom of your Zoom window. If you would like to contribute a perspective, idea, or question, please use the chat function. You can find this feature at the bottom of your Zoom window. If you would like to post a question, please do so in the Q&A box. Lastly, this session is being recorded for documentation purposes. We're also streaming live on Facebook to reach a larger audience. For those of you just joining us, once again, a warm welcome and thank you for attending this session entitled NCDs and Health Security, Strategic Pathways and Investments to Get Back on Track for 2030, co-hosted by the NCD Alliance, the World Health Organization, and the Lancet. I will now pass the floor to Mr. Richard Horton, Editor-in-Chief of the Lancet. Mr. Richard, the floor is yours.
Well, thanks so much, Romain. That was a wonderful introduction, and it's just to prove to everybody watching that this is a live event, nothing pre-recorded here. And it's really great to see so many of you sending good wishes on the chat function. It's fabulous to have this international audience meeting today. I'm just going to give you a brief introduction before we get on to the main event. My name is Richard Horton. I work at a medical journal called the Lancet. And as some of you may know, for quite a few years now, we've been working to support the cause for non-communicable diseases as a crucial issue for sustainable development. And of course, until 2020, many countries were making steady progress to achieve what we think of as SDG 3.4. In other words, reducing premature mortality from non-communicable diseases by a third between 2015 and 2030. But then the pandemic of COVID-19 hit us and disrupted many NCD programs in countries. But one thing that we really learned, not enough of us learned, but one thing that we did learn from the pandemic is that the pandemic was not a pandemic. That's to say, it was not about just a virus. It was a syndemic. It is a syndemic. That's to say, it is a synthesis of epidemics. A virus combined with a pre-existing epidemic of non-communicable diseases overlaid on a social gradient. And that combination of the biological and the social, I think, is the key to understanding the complexity of pandemic preparedness for the future. And so it is somewhat shocking, I think, that as countries and even multilateral organizations think about pandemic preparedness for the future, the issue of non-communicable diseases is not as high a priority as it should be. I would go further and raise a concern that the issue of non-communicable diseases is almost systematically excluded from our discussions about sustainable development. And yet NCDs are crucial to understanding the future health of our populations and communities. Just to give you one example, we published a series just a few weeks ago looking at the health of children and young people. And if you look at the group of young people from the ages of 10 to 20 years of age, you would be perhaps not surprised to see the massive impact of, for example, cancer, self-harm, road traffic injuries, interpersonal violence, even heart disease in those age groups. The future for young people is very much to focus on NCDs. So why is it? Why is it that we are not prioritizing NCDs in global health? I think one explanation is that there has been a sense of hopelessness, futility. NCDs are complicated. They require health systems that are functioning. They're not amenable to simple interventions, such as a simple combination of drugs or an insecticide-treated bed net. But that's a misunderstanding of what we can achieve. And a paper that I think you're going to hear a bit more about in the course of our discussions from the NCD Countdown to 2030 group explored what actually can be achieved with a cost-effective, feasible number of interventions. And when you look at those data, you can see that we can make a huge impact, averting the deaths of around 40 million people in a very cost-effective manner. This sense of hopelessness and futility is wrong. The future for global health is very much about addressing the NCD agenda. Now, we have got two panels that are going to explore some of these issues today. And after each panel, we're going to have some question and answers. So all of you who are taking part will be able to ask questions. We've got some excellent speakers, and I'm going to get straight into those speakers, and I will introduce each one as we go. I hope that we've got with us, first of all, the Honourable Minister of Health from the Republic of Ghana, that is Mr. Kwaku Agyeman Manu, who is going to talk about the outcomes of the Ghana International Strategic Dialogue around the global NCD Compact. Honourable Minister, can we begin with you? I think he's going to join us very shortly, but he's not quite with us at the moment. So I'm going to go, in that case, straight to our second speaker, and it's a great pleasure to introduce Melanie Cowan, who is from the World Health Organization, who works in their non-communicable disease department. WHO has been an absolutely decisive leader in putting NCDs on the political map for sustainable development, going back many, many years now to the work of Ala Alwan, of course, in the run-up to the political declaration. So Melanie, it's a great pleasure to introduce you.
Thanks, Richard. I did have a set of slides. And for those of you who noticed, I wasn't on that slide with all the panelists being shown because I'm actually standing in for Leanne, my supervisor, who is very sick with the flu. So I was just asked a few hours ago if I would please present on her behalf. So I'm happy to do that. And I see that my slides are up there, so I'll get started. Okay, so I'm here to talk about the Non-Communicable Disease Progress Monitor. This is the 2022 edition of the Progress Monitor, and it's more or less officially being launched right now. You can go to the next slide, please. So here we have just a very quick overview. The Progress Monitor presents a set of 19 indicators, which are essentially commitments that summarize a series of commitments that member states have taken and were summarized back in 2015 in a technical note that was published by WHO. I won't run through the text of all the indicators there, but you can just get an idea of what the page looks like. We have kind of small little summaries for each country with a small circle indicating their degree of progress on that particular indicator. This is the fourth progress monitor that we've published. The first one was in 2015, and we've been publishing them more or less every 2 to 3 years ever since. I'll just slide past the next slide, which goes through all the data sources. I think it even got pulled. I had flagged it earlier, so you can go back one, please. So the slides are, the data source slide will be at the end, and it's there for those of you who receive a copy of it. But just to note that these are all, the scoring is based on sources that we've received directly from member states with supporting documentation. So this is as reported to us in the WHO. In this slide, we have just this quick summary of some of the overall country implementation of the indicators. So in total, we have 19. And the numbers, what we're showing here on the side, so you've got 88, 77, and 26. It's just giving a tally of how many countries are falling into what we've kind of made kind of three little buckets of countries that are only fully achieving 1 to 5 of the indicators out of 19. So a good chunk are still in that kind of lowest group there, and then 77 fully achieving 6 to 10, and 26 fully achieving 11 or more of the indicators. In the graph, you have this breakdown by region, from the African region at the top down to the Western Pacific region. And by color there, you have in red the few countries that have none of the indicators fully achieved. In orange, 1 to 5, you can see that kind of dominates, along with the yellow, 6 to 10. And then we have some countries that are in green that have 11 or more of the indicators. I should add that none of the countries have all of the indicators fully achieved. So there's some actions for every country to take still. Next slide, please. There's a series of 3 slides here. I won't go through them in detail because I only have a few minutes to talk, but you have the 19 indicators listed out here. And what's highlighted in the columns there and in red is you've got the number of countries who are falling into these different categories in terms of whether they're not taking any action, there's no achievement whatsoever, partial achievement, and fully achieved. And what's highlighted in this slide is those where we have the majority of countries in that fully achieved group. I'll just say quickly, there's targets, there's NCD targets, there's NCD action plans, tobacco warnings, and also guidelines. Those are those ones that we're seeing the biggest amount of improvement. Let's go to the next slide. I'm highlighting which ones where we have a lot of countries falling in that mid-range. And if you go to the last one, as I said, I can't read through everything, but you've got the countries, the indicators where there's a lot of countries falling in that no achievement at all. So there's still plenty of actions here for countries to take. Can you continue to the next slide, please? Okay, and here we have a little bit of progress being shown. This is just an example of 4 of the indicators, the first 4 indicators, and I wanted to show what we've seen over time since we've started producing this report. So on the leftmost side and the rightmost side, you'll see a very nice trend. So we've got 2015 up through 2022, 4 little bars there showing how many countries have fully attained, on the left there, targets, and on the right, having an integrated NCD policy. So we see a nice clear trend over the last few years. It's this tremendous progress that's gone from well below 50% to now over 50% of countries. However, for mortality, for example, having a great CRBS, we don't see this quite dramatic progress, but there's slow, steady increases there too. And then for surveillance, we have a different picture where things have kind of improved, and then they've got a kind of a clear drop off there. And this is clearly due to the pandemic and surveillance activities taking quite a hit in the past 2 years, with many, many countries having to postpone these activities. So this is just one example, or a few small examples of the larger, of all the information that we've got in the progress monitor and what we've been tracking over time. Next slide, please. I know I'm running out of time. This is just to highlight that this information that we've got in the progress monitor here, like where countries are now, will prove useful for all of these various meetings that we've got running up to the forthcoming high-level meeting that will be taking place in 2025 on NCDs. So I won't read through everything there, but again, just for your information, we'll be sharing the slides after. Next slide. And of course, I need to highlight the implementation roadmap that will be presented in the forthcoming World Health Assembly, which is pushing countries to accelerate their responses, to scale up, to implement the best buys, to ensure that they're taking these actions. And here we've got the progress monitor that's giving us kind of a benchmark now to see where are countries at this state and time. And next slide. Okay, there's just 2 slides here that kind of highlight some key positive takeaways and some key negative points of where there's still a lot of room for improvement. And here is just saying that we've got about a third of countries that we've seen improvement on just since the last one. They're achieving more indicators than they were just 2 years ago. Notably, we've got clinical guidelines and plain packaging or health warnings on tobacco products. That's something that more than 50% of countries are now achieving or doing both of these, taking both of these actions. Similarly for targets, setting national targets, putting national integrated NCD policies in place. These are all really great signs of progress. But on the flip side, if you flip to the last slide here, we've got about a quarter of countries that are slid back just a little bit. We still have countries in Africa, for example, none of them are obtaining even full achievement on surveillance. No low-income countries are generating reliable mortality data. Just to give some ideas of there's plenty of room still for improvement. So I'll stop there. I hope I've just given a good quick overview of what the progress monitor is and the kind of information on it that it contains. Thank you.
Melanie, thanks so much. I think you've given us a very sober assessment of where the world stands. Some progress, but a lot of disruption in the past 2 years. And as you said, really urgent need for acceleration. I don't think we have the Minister with us yet, so I'm going to go to Dr. David Watkins. David, it's great to have you with us. David is an assistant professor at the University of Washington in Seattle, and David's going to give the key messages of the paper I mentioned in the introduction from the NCD Countdown group. David, over to you.
Thanks very much, Richard. I'm going to share a couple of slides just to give a starting point for introducing the paper. It's a pleasure to be here and a pleasure to speak to you all today. This is a screenshot of the front page of the paper for those who haven't read it yet. It's very technical. There's a lot of stuff there, so I won't go through all of the details, but roughly speaking, it's a paper that focuses on interventions and then implementation of interventions to give concrete guidance to countries on how to get back on track to the SDG 3.4 target. And the bottom line, the good news is that we can get back on track for the target as a global community, but it's going to require more resources and more effort than we're currently putting into the NCDs problem. I won't go through all of the details of the paper, but I'll share a few key takeaways that I think will be relevant in all countries. First point, NCD interventions can be cost effective and in many cases very cost effective. In this paper, we looked at a list of 15 clinical interventions, mostly in primary healthcare settings, plus 6 intersectoral policies: tobacco and alcohol control, trans fats, and salt reduction. And we looked at the value for money in implementing these across world region. And I won't go through this figure here, but it's in the paper and it shows basically a matrix of relative cost effectiveness of different interventions in different world regions. 5 out of the 17 interventions are wildly cost effective by any measure, less than 1/10 of GDP per capita for dowry averted for those who are interested in the technical details. Another 6 are in this very cost effective range as well. There's pretty broad consistency and value for money for these core NCD interventions across countries. And we also argue for risk reduction, which happens outside the health sector, is very cost beneficial. We didn't include this in our cost effectiveness analysis, but we know, for instance, that tobacco taxes are one of the single most important things that can be done in public health. So the message here is that these interventions that are in our paper are really a starting point for the NCD agenda, particularly the primary care and health system strengthening agenda. And they can form the core of the NCD agenda for the context of health benefits packages for UHC. So these are the sorts of interventions that might be considered as core entitlements for health in national UHC benefits packages. The second message is these interventions are very effective. They can accelerate progress on mortality reduction especially for cardiovascular disease and diabetes. Now, we looked at the annual rate of change in deaths from these various causes that are shown on the y-axis that are a set of NCD subcauses. And the purple mountains here are basically the distribution of rates of decline over 2015 to 2019 by country, so 123 low and middle income countries, showing the spread. And anything that's to the left of 0 is negative, which means mortality is going down, which is good. Anything that's to the left of the red line means it's going down faster than the benchmark rate needed to achieve the target. So you see that there's not a lot of progress on the historical traces in purple. The good news is if we really scale these interventions rapidly, you can see a shift, and this is what these yellow sets of plots are about, a shift negative, an acceleration to more negative in rates of decline from particularly cardiovascular disease and diabetes, to a lesser extent cancer. The cancer story is challenging because a lot of what can be done in cancer now takes more than 7 or 8 years to achieve, particularly prevention through taxation of tobacco. So some of the progress is a bit delayed for things like cancers, but in the very long term, these interventions can really shift the mortality pattern for NCDs. And you see here in the very bottom that about 83% of countries or so could achieve the NCDs target by getting mortality rates of decline faster than needed if these interventions were fully implemented. The other thing is that the mix of interventions does vary a bit by world region. If you're trying to keep costs down, some regions will require less investment in clinical services than others because they're already more on track, or risk factors prevail as the drivers of the NCD burden. But overall, we found that when we did some optimization and modeling work, that low and middle income countries on the whole, in the average, and then 55% of specific countries could achieve the 3.4 target by deploying these interventions at reasonable levels of implementation, reasonable levels of coverage. Now, most countries that didn't actually cross the line to a third reduction could get pretty close to it. So 55% is an artificial dichotomy. All countries would see rates of decline accelerate. Now, one important message from this paper is that tobacco and alcohol are critical to achieving the target, but they're not enough. We need to invest in healthcare systems. We need to invest in cardiovascular disease treatment and cancer treatment in order to really build health systems of the future. And so we view a holistic approach that values intersectoral action and risk reduction, but also builds health systems together around these core interventions in primary health care.
Dear David, would you actually mind for our interpreters and note takers to speak a bit slowlier? Would it be possible for you?
Sure.
Thank you very much.
Sure. The other message here is that the reason that some countries don't achieve the target is because they have constraints for scaling up interventions. The rate of expansion of coverage of services based on historical patterns is less than is needed. So what we really need to do is invest in research and development to get technologies out to people faster. We need new approaches, digital health solutions, drone-based delivery, all sorts of things that can scale up interventions faster than we have in the past. And that really is going to be the key driver of mortality reduction, getting healthcare out to the people who need it, particularly those at the last mile. The final message here is that we need to spend more money on NCDs, but we don't just spend more money on NCDs and health overall. We target money towards high priority investments. We estimate that an additional $140 billion would be needed over the next 7 or 8 years across the 123 low and middle income countries we looked at. And it works out to about $18 billion a year, or $2.50 US dollars per capita. This would buy a lot, 39 million deaths averted between now and 2030, a really, really massive payoff. If you work this out in economic terms, that means $2.7 trillion in benefits, which works out to a benefit to cost ratio of 19:1. And this is actually on par with the kind of benefit cost ratios you would get out of reproductive, maternal, neonatal, and child health investments. And really shows that NCDs can be invested in wisely, resources can be spent wisely to deal with the problems of the future. I'm happy to answer questions. I just want to acknowledge the co-authors on this work. It was a massive amount of work analytically and with a lot of keen oversight by senior people in the NCDs field. And I want to acknowledge the funders from Norway who made this work possible. Thanks very much.
David, thank you so much. And if I might say, you described the paper as very technical, but I found it an absolutely gripping read because you take the reader so logically through the whole argument of how these 21 interventions can make an absolutely earth-shattering difference to the lives of people around the world. It's an absolutely fabulous piece of work. You know, having the investment case should be transformational for decision makers trying to decide where to allocate scarce development resources. So congratulations on your work. Now, I'm really delighted to be able to introduce the Minister of Health from Ghana, the Honorable Kwaku Agimang Manu. Thank you, Minister, for being with us. I believe you're going to give us a briefing on the outcomes of your own country's international strategic dialogue about NCDs. Minister, the floor is yours.
Thank you very, very, very much. Let me start my video. That's all right. It is a pleasure, a great one, to be part of this important high-level 75th World Health Assembly pre-event. Kindly permit me to express my appreciation to the WHO, NCD Alliance, and the Lancet for co-hosting this event. I'm once again privileged to be part of this event. The International Strategic Dialogue and the National Roundtable came off at a critical time. It was timely and significant in that it came at a time when the world was gradually recovering from 2 years of COVID-19 infection, which has generally affected lives and livelihoods and threatened our very existence as people of this world. We all know that this pandemic exposed the link of non-communicable diseases with vulnerability to severe COVID-19 illness. The time was right, therefore, to raise the profile of the NCD agenda within the SDGs. The National Roundtable and the International Strategic Dialogue provided an opportunity where national and international actors and partners came together to reflect on the current situation of NCDs, especially in low to middle income countries, identify new ways to strengthen collaborations in resourcing, knowledge sharing, and technical assistance for bolder national NCD responses, bearing in mind the SDG targets for NCDs that member states have signed on. Mr. Chairman, kindly permit me to recount some of the highlights of the National Roundtable and International Strategic Dialogue. There were 2 events back to back, and I'll start with the National Roundtable Dialogue. The format for the Roundtable Dialogue was a panel discussion. Preceding the panel discussion were presentations on the value of strategic partnership in data and research in non-communicable disease prevention and control in Ghana. During the discussions, the panelists agreed that NCD treatment in Ghana needed certain conditions, and for the policy to be successful, it will require availability of treatment centers, specialist adequacy, drug availability and access, funding, and new ways of national resource mobilization. For example, bequeathals. After an informative and insightful panel discussion, the NCD policy and strategy, as well as the WHO NORAD initiative, was successfully launched. The policy is expected to provide the necessary framework and governance structures needed for the significant prevention and control of NCDs by 2030. It is expected the implementation of the policy may cost the Ghanaian cedi equivalent of $110 million. Now I'll move on to the International Strategic Dialogue. The ISD on NCDs and SDGs, which was jointly hosted by Ghana, Norway, and the WHO, was to raise the priority of non-communicable diseases within the Sustainable Development Goals agenda in Accra, Ghana. The event brought together national and international actors and partners in the NCD space. The First Ladies acknowledged that cancer, high blood pressure, diabetes, and the like were the highest cost of premature deaths in the world. And let me mention the first ladies who came for this ISD, the International Strategic Dialogue, were two of them. The first lady from Congo and our own first lady in Ghana here. They mentioned that NCDs which affected women and children were breast cervical cancers, as well as childhood cancers and child obesity. It was brought to the fore that through investments in preventative healthcare, funded access to free healthcare and medications, their countries will make progress in addressing the challenges of NCDs. The heads of state in agreement noted that NCDs remain the largest cause of death worldwide, with an increasing burden in LMICs and have far-reaching economic ramifications. On behalf of the Ghanaian president, there was the denunciation of these diseases as silent murders, emphasizing the close link between NCDs and COVID-19. In summary, the speakers at the meeting highlighted the burden of NCDs and acknowledged that political will and action was needed to drive the NCD agenda. Ladies and gentlemen, the main outcomes of the national and international dialogues of the launch of the NDC policy and strategy and the launch of International NCD Compact 2020 to 2030 and the Presidential Council to provide leadership on the prevention and control of NCDs. Ghana was indeed proud to have hosted such a groundbreaking event, which saw heads of government show their political commitment to increasing investments for the prevention and control of NCDs. Mr. Chair, ladies and gentlemen, the theme for this important high-level 75th World Health Assembly pre-event, which is NCDs and health security, strategic pathways and investments to get back on track for 2030, perfectly aligns with and reinforces the commitments by our heads of state towards the prevention and control of NCDs, as reflected in the International NCD Compact 2021 to 2030. The compact is certainly a turning point in our fight to reduce the burden of NCDs. The NCD Compact will galvanize action to meet the demand for support from heads of state and governments to close the implementation gap and fulfill 5 specific time-bound commitments based on the consolidation of existing commitments. Research has shown that low and middle income countries can still reach SDG target 3.4 to reduce premature mortality from NCDs by 1/3 by 2030 through the implementation of a cost-effective package of NCD prevention and treatment interventions. It is for this purpose that the NCD Compact and the Presidential Group were launched. The NCD Compact and the NCD Presidential Group have set a multi-year goal of accelerating progress towards SDG 3.4 by 2030 by urging countries to align their plans and operations with universal commitments to speed up and scale up global efforts to prevent and manage NCDs and attain universal health coverage. In line with the above, it behooves on national actors, including myself as health minister, and all health ministers of health, all ministers of health, to ensure that policies on tobacco, harmful use of alcohol are developed as part of our national responses to the management of NCDs. Most importantly, we need to fashion our strategies that will enable the incorporation of treatments of NCDs in our health insurance schemes. Ghana has already started with breast and childhood cancers on the health insurance medicines list, thanks to the work of our First Lady, Her Excellency Rebecca Akufo-Addo. The NCD Presidential Group will be a platform for exchange, collaboration, and action on NCDs among interested heads of state and governments of WHO member states. The group will meet annually on the occasion of the high-level general debate of the UN General Assembly. It is interesting to note that the President of Ghana will chair the first meeting of the Council, which will take place in September during the 77th session of the United Nations General Assembly in New York. Ladies and gentlemen, the above narrations justify why the President of Ghana, Prime Minister of Norway, and the Director General WHO convened this high-level dialogue on the 12th of April 2022 in Accra. It was a timely intervention, and I beseech all of us to increase our efforts at ensuring that premature mortality from NCDs were reduced by 1/3 by 2030. Let us leverage on the partnerships we have built and lessons learned in Accra to move the NCD agenda forward. Truly, we can. I thank you so much.
Thank you very much indeed, Minister. And may I offer my heartfelt congratulations on your leadership. For those who read David's NCD Countdown paper, you will see the importance that the countdown attributes to political commitments, and you and your government are indeed showing that. Thank you. And indeed, one other area that David highlights as being critical to the future for NCD advocacy and implementation is civil society mobilization. And so it's a great pleasure to introduce somebody who's been working as a civil society leader for many years, Katie Dane, who, as you know, is the Chief Executive Officer of the NCD Alliance, which brings us all together to have our aligned messages. Katie, it's great to have you with us. Over to you.
Thanks a lot, Richard, and great to be with everyone. Thanks for joining this important event. So I wanted to just touch upon opportunities for building momentum on NCDs after the fantastic international strategic dialogue that the Honourable Minister of Ghana has just highlighted. And I think obviously the outcomes from that meeting are critical in terms of the establishment of a leadership coalition, a presidential coalition on NCDs, which is bringing NCDs to the highest political level, heads of government, heads of state, which is what we've been wanting to see for a long time, as well as that global Ncd Compact. And I think if you look ahead, there are many opportunities for really capitalizing on this momentum, including just around the corner with the World Health Assembly having possibly the biggest NCD agenda that I've seen anyway for the last decade. And so that is an opportunity for us all to be trying to ensure that NCDs are high on ministers of health and government agendas, even whilst we're still going through a critical pandemic. We've also got, obviously, and the second panel will be touching upon this more, but the negotiations in Geneva happening right now in terms of the WHO pandemic treaty. And as Richard highlighted at the beginning, the fact that NCDs are so interlinked, that does provide us with a critical opportunity to be getting our messages across about the need to link NCDs to COVID-19, health security, and pandemic preparedness and response, including really trying to push for a broader definition of actually what health security means and looks like, including things like the metrics. The Global Health Security Index previously never even gave a nod to non-communicable diseases, and that resulted in a fairly skewed ranking of how well countries were prepared. And I think COVID-19 has really shown the need to kind of take a broader approach and look at underlying burdens such as NCDs in countries when we're looking at that sort of thing. And then, of course, we've got UN high-level meetings coming up, such as the Universal Health Coverage high-level meeting in 2023 and the NCD high-level meeting in 2025. So there's clear milestones that we can be working on. But I think my main message here is in order to really capitalize on these opportunities, we need to see three things. And I think the first thing is shifting the narrative to focus much more on the solutions and the investment case, which I think the new countdown paper that David has highlighted really does. It really emphasizes the fact that progress is possible, that all countries can achieve SDG target 3.4 with strategic action and investment. It highlights that there are the solutions that are available, which are evidence-based and cost-effective. And I think most importantly, what the paper does is it does provide that investment case and the clear price tag that we've been missing for so long in NCDs, and really using that data with ministers of finance as much as ministers of health to make the case that NCDs are an investment for health, for sustainable development, for health security and pandemic preparedness, as well as healthy longevity as well. And so using that data to really kind of drive the message home of this is feasible, this is possible, and it's cost effective and has a huge return on investment, as David was saying earlier. I think the second thing that...
Very sorry, would you mind speaking a bit slower for interpreters, please?
Sure.
That was splendid. Thank you very much.
I would say that the second thing that we need to see happen is focusing and really shining a spotlight on where countries are making progress and inroads. Where are the countries that are trailblazing across NCD prevention, care, financing, community engagement? There are many countries that are doing fantastic work. If you look at Mexico with their work on obesity prevention and the package of policies that they're putting in place. If you look at many countries like Barbados and Nigeria, who have just introduced sugar-sweetened beverage taxes. On the financing side, Norway being a trailblazer on having the first development strategy for NCDs. And if you look at care, countries like Rwanda and the Philippines and Ghana really integrating NCDs into their universal health coverage response, as well as many countries doing fantastic work in terms of community engagement. But are we really kind of shining a spotlight and really understanding what's working and what have been the enablers to their success so that we can really encourage other countries to follow? And then the third thing I would say is we need to also really hunker down on the systemic bottlenecks that are impeding progress in countries and globally. And I think some of those things are, politics, political leadership and political will, making sure that when political will is there, we can see change overnight. That happened with COVID. Why can't it happen with NCDs? Ensuring that the money is in place, not just in terms of more money, but better use of money and making sure that we're investing in the right things in terms of policies and interventions, and tackling head on things like industry interference, which continues to really undermine a lot of the effective public health policies that we know works. So I think those are kind of three of the main things that we need to see in order to really capitalize and build momentum around NCDs. Back to you, Richard.
Thanks very much indeed, Katie, for that very clear prioritization of actions. To conclude the first panel, it's a great pleasure to introduce a very important partner to our work, and that is the World Bank, and Dr. Feng Xiao, who is from the Strategy Operations and Global Engagement Division of the World Bank, is going to talk about the implications of the NCD Countdown findings for financing policy and financing instruments, so critical to our work. So, Dr. Zhao, over to you.
Thank you so much. Very happy to be here to talk about NCD, a topic very close to my heart. And good to see so many familiar faces. And Richard, good to see you again. I have 5 minutes. Let me jump into it. I want to talk about first some trends and factors around NCD financing, and then close by highlighting some of the priority investment areas the way I see it. When it comes to financing NCD, it's getting very complicated, as many colleagues already touched on it. First, despite the strong investment case, as highlighted by David and others, financing for NCD is extremely limited. We talk about there's no global fund for NCD, for example. Compared with infectious diseases and the pandemic financing, little attention has been given to NCD. If you look at overall global development assistance, there's a less than 1% going to NCD. So we do have a picture which is very worrisome. And COVID-19 has further complicated the situation. The World Bank has recently published a report called Double Shocks and Double Recovery. The key message there is COVID is not just a health shock, but also economic one. the global economy has been heavily affected. The physical space will be very tight in the next few years. And the health budget in many countries facing great uncertainties. Furthermore, Ukraine food crisis, supply chain interruption, all contributed to those complications and uncertainty. So that's the situation on the negative side. But the sky is not all gray, and we do have some shining light and positive development in financing NCD. First, many of the health sector reforms which are taking place in different countries are anchored around NCD. Cardiovascular disease, cancer, diabetes, mental health, those are priorities in many of the health reform agendas across different income levels. In many low and mid-income countries, we see this trend is taking off. So this is no longer a rich country's problem. So NCD and mental health has been anchored in the country's priority and health reform programs. Let me take the World Bank as an example. Our health, nutrition, and population portfolio has significantly increased following addressing NCD and following responding to COVID. Now we have $30 billion portfolio. About 11 billion is around COVID response, but the other 2/3 are really supporting health sector reforms across different countries, including strengthening PHC, strengthening hospital reform, encouraging integrated care. We do see a strong NCD angle in all those operations. So we can piggyback on those financing to address NCD issues. We also see the unique angle for NCD, which is the risk factor arena. Some of the policy levers on risk factors can actually, believe it or not, can generate resources. Tobacco taxation is a great example. In many countries, it not only help reduce consumptions, but also bring additional revenues. Ministry of Finance is normally the driving force behind this initiative. So we do have some positive development we can look into. Now, I want to lastly touch on a few priority investment areas the way I see it. The first one is investing in upstream interventions. David has highlighted a set of very cost-effective interventions, mostly at PHC settings. I want to say this is an area the World Bank also want to look into. In many countries, we recognize there's basically no early screening program, even in some of the mid-income countries, as the resources concentrate on hospital and others. I see this is a great area which we can invest. Invest in early prevention, in risk factor and behavior changes, together with health system strengthening. That's its priority for us to move forward. Those are high return areas as the paper has highlighted. But I see in terms of financing has not got it deserved attention. So that's one. The second one is investment in integration agenda. We shouldn't see NCD as a vertical program. NCD is a big part of cross-cutting areas in UHC, in health system strengthening. We talk about PHC need to be strengthened. I see a great need for integration between NCD and PHC. And things already happening. I recently visited some countries. I see many innovations already happening in countries which they integrate NCDs into PHC, into other service delivery. We talk about the great integrated care agenda, which is already taking off. And Ghana is a great example. we should really focus on those areas. And there's a large amount of financing actually in supporting health system strengthening. The bank is a big part of it. And integrating PHC, integrating NCD and the mental health into PHC, into health system delivery, I think will bring a lot of positive effect to us. And Richard, you have highlighted some of the areas which we need to pay attention. I also want to highlight investing in community intervention. This is one of the surprise, I have to say. When I was in Ukraine, I lived there for 4 years. We have a lot of interventions in hospital sector, in PHC. But one of the nice surprises, we spend little money in community. Basically, we call the healthy school program. The community buy some food and organize health behavior sessions, and the villagers coming together talk about how to manage diabetes, how to manage cancer, how to encourage healthy diet. It has great impact. So this is area which we haven't talked about, but I do see this is area we can look into more. Lastly, let me see investment in the policy levers, build on tobacco taxation program, but also looking into alcohol and sugary drinks. Those are the areas we can do more. Let me finish by saying knowledge sharing and data are two areas we need to also look into it. There's many innovation already happening across countries. Just by simply cross-learning and put those knowledge together, will have great value. And lastly, and I know WHO and my great friend Banti will talk about data on NCD. This is another areas I see it will have great impact for NCD activities. Let me stop here, Richard.
Thank you so much, and a particular thanks for emphasizing the point that this is not another call for another vertical program. Absolutely not. This is about a cross-cutting health sector response and fully integrated with the agenda for universal health coverage. So thank you. Now, we have limited time for questions because I want to move on to the next panel on the hour, but I'm going to ask one question which comes up in the discussion, and it's a question I'm going to put to David because it's a technical question about his paper. David, in your paper, you argue that we need to take a long-term view about NCDs rather than a short-term view. However, you and I both know that politics doesn't work like that. Politicians, understandably, want quick wins. So you've got 21 interventions. Tell us which of those interventions have the quickest impact that can guide politicians for building support for this agenda?
Great question, Richard. I think that a neglected area of the NCD's agenda is in managing complications, acute complications, particularly of cardiovascular and respiratory diseases at the primary care and first level hospital level. A lot of the care that's being delivered currently for people with exacerbations of COPD or heart attacks or strokes is not being done at a very high level of quality. And there was a Lancet Global Health Commission a couple of years ago on high quality health systems that really highlighted that most of the deaths around the world were due to poor quality care. These solutions are pretty simple. We're not talking about big fancy equipment. We're talking about giving people aspirin when they have chest pain. We're talking about giving them nebulizers when they can't breathe. These sorts of things can be done at a district level, and they can save a lot of lives. And there's a lot of value to be demonstrated through life-saving interventions that can be deployed relatively quickly. Hospital care is not very popular in public health, but it's a critical part of the response to NCDs, and it's an ethical imperative to treat people who have health needs right now. So to balance the short-term need to demonstrate value and the long-term agenda to prevent, we need to invest critically in health system capacity, particularly at that level, to respond to acute needs in a cost-efficient manner.
That's fantastic. Thank you very much indeed, David. I'm actually going to move on to our second panel. Thank you to all of our speakers in the first panel. We're going to switch gears then now and talk a little bit more broadly about the issue of health security and how we rethink the issue of health security in the context of, number one, post-COVID, number two, the NCD epidemic. So we're going to begin with Ms. Charity Maturi, who is a member of Our Views, Our Voices, a global advisory committee. Charity is not going to have her camera on to ensure that we get to hear her words clearly. Charity, over to you.
Thank you so much. My name is Charity. I served in the National Task Force on Mental Health and currently as a court petitioner in decriminalizing suicide in Kenya. I have lived with a mental health condition and suicidal ideation for 27 years and care for parents with 6 non-communicable diseases. Managing NCDs has a psychological toll on us, leading both patients and caregivers to depression. High NCD treatment costs lead us to financial hardship and poverty with no social protection and with only 3% of all NCDs, for all NCDs in the Kenya health budget. COVID-19 affected us through survival and healthcare crisis, hospital closures, disrupted access to essential medicines, movement to specialized clinics, and fear of contracting COVID. I lost 4 relatives with pre-existing NCDs reported as COVID deaths, and I'm still angry that their years of fighting NCDs were ignored, denying us statistics and NCD improved response. We are very happy that the strategic dialogue and NCD Countdown strongly positions NCDs in the SDG agenda. Our NCD Alliance global agenda on recovery focuses on inclusive governance, prevention, social protection, strengthening community primary health systems with NCD wider coverage. The 2021 political declaration of UHC stated that UHC cannot be fully achieved without mental health. And so we need to integrate mental health in NCD management for better health outcomes. On community advocacy, we have realized that when health systems fail, we pay with our lives. So we are fighting for patient inclusion in health decision-making tables and influencing communities to join this fight. Advocacy and policies are challenged because our valuable expertise is unpaid, while financial and technical capacity locks us out of health grants and consultancies. In 2020, we pushed for inclusion in the National Task Force on Mental Health, but could not find any health policy right or legislation on inclusion. So we used disability rights in the UN Convention of the Rights of Persons with Disability, which has been adopted by the WHO Quality Rights Program, which qualifies mental health conditions as disabilities, and mobilized communities to push for our inclusion. We are now using my inclusion in the task force as precedents for patient inclusion. Last month, our National Hospital Insurance Fund, Kenya, called for public participation. We mobilized patient-led organizations, put pressure through human rights organizations, including the International Commission on Jurists and Kenya National Commission on Human Rights. And we finally did a very strong press statement that gave us an opportunity to meet the NHIF CEO, who invited us to a special meeting. I recently presented to the Parliamentary and Senate Health Committees, and our NCD Alliance, People Living with NCDs Chair, John Gikonyo, yesterday engaged our Ministry of Health Cabinet Secretary. Our call to action to them is the same to you today. We need mandatory inclusion in health policy leadership and for patient inclusion to be enabled in health policy and legislation. We are also calling upon multilaterals, governments, civil society, private sector organizations here to endorse the global charter of our meaningful involvement as people living with NCDs. The link is being shared in the chat. We are saying nothing, nothing for us without us. Thank you.
Charity, thank you for that very powerful call to action. I really appreciate it. And I think the issue you raise about the stress and the mental health consequences of caring for people living with non-communicable diseases is hugely neglected. Thank you for drawing attention to this. Now, I've already mentioned how central the World Health Organization has been for convening countries, for galvanizing political action, for tracking progress, and for giving technical assistance to countries. And a person who has been at the center of that work for some years now, it's a great pleasure to introduce the director of the NCD department, Dr. Bente Mikkelsen. Bente, over to you.
Thank you, Richard. That was a very warm introduction and great to see you as well. And I would say, Excellency, I don't know if the Minister of Health of Ghana is still with us, but we owe him and his leadership so much. And the same with the government of Norway, the Prime Minister of Norway, really convening again, but this time really for action at the highest level in Ghana. So colleagues and friends and partners, thank you for doing this vital event. And this time I will actually focus on the health security agenda and tell you a little bit on what is happening in WHO, because I don't think that's so well known. First of all, as Katie said, and it's probably the biggest NCD agenda ever. Hopefully, it will go through as it stands. It will give us a further strong mandate on many things: implementation, roadmap, acceleration, but also the health security agenda, humanitarian crisis. I think many times in this community, we have discussed COVID-19. And I think thank you for all of you shouting so loud, really making the strong voices from the people living with to the healthcare people. And now really realized, I think, by most governments that people living with NCD is among the most vulnerable. And thank you, Richard, for calling it a syndemic. This has really opened doors and windows for us, and I will explain a little bit more. We don't know the precise figures for what is the excess mortality for NCD, but you might have seen that WHO showed just this week that there is a staggering 14.9 million excess deaths. And this is actually 3 times as many as was reported as proper COVID-19. So we can only imagine that probably we have at least 70 up to 90% of those being on NCDs. And we know that even still in January, we have huge disruption, 2.5 years into the pandemics for the major NCDs. So I will continue now to more focus on the humanitarian emergencies and health security. But I think this situation has opened the inroad for us to know for real work on humanitarian emergencies and health security at large. And there is a lot to do. I think we learned this year that the United Nations Office for Coordination on Humanitarian Affairs estimated 235 million people needed humanitarian assistance and protection last year. And we know that there is probably as much as 2 to 3 times more common to have heart attacks and strokes in humanitarian emergency than pre-emergency circumstances. So again, we have syndemics, or even more, we have acceleration and a real challenge. This has been known for ages, I think. I mean, people on the ground would report this, but we haven't really made it to the mark to be included into agenda. And this time we are really included. So unfortunately, we have the war in Ukraine. And the good thing I can report is that my team is now in the daily coordination for the response in Ukraine. So we are using the NCD kit that now covers 10,000 people every 3 months. And it is actually the most popular, let's say, kit that we have. So it is been used in 20 countries, and we have procured medicines and devices for $3.6 million US. So I think the recognition is something that we need to build on. And we also are able now to deploy people. So we have deployed the delivery of rehab equipments to Ukraine. So my colleague Pete Shelton is recently returned as a trauma rehabilitation working group in Poland. We also saw during COVID that we fought, I think, together with all diseases to get the Pillar 9 into the strategic planning framework that WHO delivers. When we took account approximately a year after this pillar was included, which is about continuation of healthcare, we saw a very disappointing inclusion into the country response and planning structures. So that was disappointing, but this is an entry point for all of us on this call and all partners. I want to let you know that there is not a lack of mandates. So if anybody is asking, why are you sort of, actually somebody asked in 2021 when we had an annex on humanitarian emergencies for NCDs, but there is no lack of mandates. So we can go back even to the political declaration in 2011. We have a renewed one on diabetes. And of course, there is this ongoing discussion about WHO preparedness and response. If you look at the paper we have provided for this year's World Health Assembly, you can see how WHO is working in this field. So we are working very hard to integrate NCD into emergency responses, as I just mentioned. We will be part of emergency operations going forward. We are doing public health situation analysis, rapid assessment, situation reports. We continue to coordinate at 3 levels, support neighboring countries. We look very, very sort of strongly into the procurement of essential medicines and devices. And we also work very closely with partners. And I would like to add, if you look at the 5 new commitments for our DG, who is now, he will be elected, he's the only candidate. And one of his priorities is to reorient health system to primary healthcare and to deliver foundations for UHC, health security, and health and well-being throughout life. And that's where we come in. There is no health security without including NCD into PHC, into UHC, and to accelerate the responses, invest now. We cannot see yet another pandemic or a big war or whatever, again, prove in the evaluation report that the major loss of life is again for people living with NCD. So I think it's the time. So I would like to continue very shortly with thanking David. Really warm congratulations. For me, this is really a game changer, and it's very optimistic because it shows that it is possible to strengthen, to really strengthen also the UHC, the PHC, choosing pathways, and it is possible to reach the SDG 3.4. I think we need this very positive news. And this resonates also with another paper going to the World Health Assembly, our implementation roadmap, and it's of course going hand in hand with the analysis that David and academia, the group, the Countdown has been doing. So I think if we believe that we are going to do real good for the world, we need to always think through. We are 74% of all global deaths. People are more vulnerable during crisis and pandemics. People living with NCD and humanitarian emergencies need a special attention, and we need to provide the advocacy, the governance, and also the tools. And we probably need to supplement the tools, but we need to act on data. So thank you very much for giving me the speaking role, and I look forward to really work together with all of you. But be minded, the fight for NCD is not easier than before. We have many difficulties. We see a tendency to fragment the agenda and try to only look at risk factors as one thing, management as another thing, and emergency as a third thing. We need to utilize what our people before us in 2011 really laid the ground for. Look at this integration, look at the integration of this into primary healthcare UHC, and we will be able to build more preparedness for the future. Thank you.
Thank you, Bente, and congratulations on being able to put NCDs at the center of the World Health Assembly forthcoming. I know that that's no easy success, so well done. And I wish you well for the Assembly.
Thank you.
On several occasions now, the subject of humanitarian settings has been raised. And so it's a great pleasure to be able to introduce Mr. Nikolai Haugard, who is Senior Director and Acting Head of Global Access to Care for Novo Nordisk. And he's going to share his experiences of supporting people living with non-communicable diseases in humanitarian settings. Mr. Haugard.
Thank you very much, Richard. So someone has stopped my video, so I'm not allowed to turn it on by myself, but maybe someone can do that for me. There we go. Thank you. Let's see. Yes. Good to see you, and now I hope you can also see me. So thank you, Richard, and thanks to all the organizers for putting together this event and for inviting us to share our perspectives and a little bit about our work. Also, a big thank you to you, Bente, and the WHO for all the great work you are doing on NCDs and the diabetes agenda. So to echo what you just said, Bente, we need systemic change. NCDs in humanitarian settings are more important and crucial than ever. Unfortunately, we're living in a time of instability and disruption. From Novo Nordisk, we have been working on this for several years, and we really got involved because we saw a need. We were increasingly in dialogue with relief organizations that wanted to provide care for people living with diabetes in humanitarian settings. And in 2017, we established our humanitarian program. And I really have to stress that it takes employees, it takes good colleagues that really believe in this agenda and drives it forward, because it is really difficult. As part of our focus, we have taken several steps to improve our own preparedness and how we are functioning and operating as a company to be able to better serve the needs of the humanitarian organizations. First, we have expanded our preferential pricing policy for human insulin in resource-poor settings to also cover organizations with humanitarian operations. So since 2001, we now offer human insulin at the cost of $2 per vial to humanitarian organizations. And secondly, based on dialogue with several humanitarian organizations, we have reworked our internal procedures and systems to better support humanitarian organizations. We now have a dedicated humanitarian support team here in our global headquarters, and we have been able to cut our lead time for humanitarian orders in half. And that means a lot, because being able to provide insulin at a rapid speed in humanitarian situations is really crucial. We also now keep a small stock of products reserved for immediate shipments during emergencies. Thirdly, at the request of humanitarian organizations, we at Novo Nordisk in 2019 established a cross-functional working group to assess what we could do to address the problem of heat stability of insulin. This year, actually just in the last month in April, we obtained a positive scientific opinion from the European Medicines Agency for 2 of our human insulins. They can now be stored outside of refrigeration for 1 month before opening. And we hope that this will be a real game changer and have a true impact for many people living with diabetes in hot climates, including those living in humanitarian settings. In general, we really strive to support the humanitarian organizations in the best we can. During the height of the COVID-19 pandemic, we saw our supply chain capacities as a global pharmaceutical company, how they could help to bring diabetes care products to places where supply chains were disrupted. And now, during the war in Ukraine, we have been working closely with our colleagues on the ground and in the neighboring countries to support the national authorities and various humanitarian actors to safeguard access to insulin for the many people affected by this horrible war. And when it comes to the actual capacity to treat people living with non-communicable diseases in humanitarian crisis, we as a pharmaceutical company are not the experts. But we also realize that, of course, we do have a responsibility. And we are really keen on hearing inputs to what we can do better and how we can form partnerships to address the need. We have established a partnership in 2018 with the International Committee of the Red Cross and the Danish Red Cross that we call Partnering for Change. The aim is that together, we hope that we will be able to find ways of improving chronic care affecting those people living in humanitarian crisis. Unfortunately, very little is known today about providing good care under these circumstances. Therefore, we also partnered up with our academic lead partner, the London School of Hygiene and Tropical Medicine, and local academic institutions, because we do believe that data and evidence are key to ensure that we can improve the work we do. So we are collecting data and we are developing models for NCD care, both globally, but also in our 2 pilot countries in Lebanon and in Iraq. Based on the gaps we then identify, our humanitarian partner organizations are implementing and adopting approaches to NCD care in their operations. And hopefully this will lead to better outcomes for patients. Most specifically, these approaches focus on better integrated care and peer support. And we are also ensuring that all the findings are published in peer-reviewed articles and made available for everyone. So just to conclude, ensuring the continuity of care for people living with NCDs is always complex. The complexity further increases when trying to do so in humanitarian crisis. Better preparedness can take us part of the way, but it is also necessary to rethink how care is provided during times of instability and displacement. There are no quick fixes, unfortunately, but as a global company, we are committed to do what we can. And we really do believe that the only way to go about systemic change is to do it through public-private partnerships. So we also invite everyone to engage with us on this agenda. Thank you very much, Richard.
Thank you, Nicola. I really appreciate your work and commitment, and thank you so much for describing it to us today. It's a great example that I hope other companies can follow. Let me turn now to the continent of Africa. And one of the great successes in global health was the creation of the Africa Centers for Disease Control and Prevention, which was officially, I think, proposed in 2016, but officially launched in 2017. And so it's and of course, terrible that we had the pandemic, but very good that we had Africa CDC to play such an important leadership and coordinating role for Africa during the pandemic. Let me turn to our next speaker, Dr. Adelard Kakunzay, who is from the Disease Control and Prevention Division at the very same Africa CDC. Adelard, over to you.
Thank you so much, Richard, for this excellent introduction. Good morning, good afternoon, distinguished panelists, colleague on this call. Good morning, good afternoon, participants who are following us from worldwide. So I'm joining this meeting from southern region of Cameroon, where we are supporting the Ministry of Health to accelerate the COVID-19 vaccination rollout. And it's really a pleasure to be here 2 weeks after Africa CDC launched its non-communicable injuries and mental health strategy. So as Richard has mentioned, my name is Adelard Kakunzay, and I'm the non-communicable disease and mental health unit lead at the Africa CDC. So my talk will be on the syndemic of NCD and COVID-19 in Africa, and more importantly, on the lesson learned for pandemic preparedness and response. Talking on the impact of COVID-19 on NCDs, there's now strong evidence that NCD have been associated with increased COVID-19 mortality. In a modeling a study published in the Lancet in 2020, it suggests that if 1 in 5 people worldwide are at an increased risk of severe COVID-19 infection, should they become infected, mostly as a result of underlying NCD. And in a case control study conducted in Nigeria and Ethiopia in the same year, 2020, hypertension, diabetes, and renal disease, among other NCD, were strongly associated with higher COVID-19 mortality. And COVID-19 also disrupted the health system. We've heard from other speakers, and affected mostly the NCD management. And those disruption affected mainly the routine health services, where we've seen lockdown have led to the suspension of community health worker visits and non-emergency outpatient clinic, which are particularly vital for the continuity of care for NCD. And we've seen a disruption in terms of access to medicine, screening, and surveillance, and most importantly on public health resources and workforce. And in a WHO study survey on the impact of COVID-19 on NCD resource and services, and almost 90% of the African country reported that they have to fully or partially deploy the NCD staff to work on COVID-19. And in a continent where the large proportion of the population is working in the informal sector, lockdown measure has, huge consequences, such as job loss, high food prices, precarious living condition, which affects the lifestyle, favoring unhealthy diets, sedentarity, and increased stress, with a deterioration of pre-existing condition and onset of new NCD and mental health disorder. Heard on our colleague Charity mentioned on the huge impact of COVID-19 on mental health. So COVID-19 have overwhelmed the health system. taking scarce resource from fending off concurrent epidemic and addressing the already high disease burden of NCD and infectious disease on the continent. And before COVID-19, the continent have learned several lessons from the Ebola outbreak, as Richard had mentioned, in terms of strengthening surveillance and governance system, building national pandemic capacity for pandemic preparedness and response, and of course, ensuring significant sustainable funding. And this is the Africa CDC was established as the continental public health agency to support public health initiative of African Union member states and strengthen the capacity of the public health institution to detect, prevent, control and respond quickly and effectively to disease threat. But to succeed and ensure health security in the region, there was a need for coordination, communication, and collaboration. And this is where COVID-19 was an opportunity. And the continental COVID-19 response through Africa CDC was an opportunity to invest in the regional capacity building by strengthening unity and solidarity between African Union member states, coordinating harmonization of policy across the African Union and the regional economic community, promoting and defending common African position, advancing research, science and technology, and of course partnerships to eradicate preventable disease and promote good health. And on COVID-19, listen, it's worth really taking time to look at the joint continental strategy. 1 week after the first confirmed case on the continent in February 2020, the Africa CDC convened Minister of Health at the African Union headquarters in Addis Ababa to adopt the African Joint Continental Strategy for COVID-19. And this strategy provided a dimensional framework to strengthen public health response and created several unprecedented mechanisms. Here I can give example, the African Union COVID-19 response fund, the partnership to accelerate COVID-19 testing, where that were used to ramp up testing at a time where the vaccine gap were still huge. The Africa Medical Supply Platform to improve Africa bargaining power while promoting local manufacturing. The Africa Vaccine Acquisition Task Force to establish to complement global initiative. It also allowed multi-level support model, aligning the priority of the African Union in its organ and agency to empower country with support from member states. And it also helped in terms of really advanced resource mobilization and workforce to scale up really practical training to support expansion of the public health force needed for IPC, for example, laboratory, genomic surveillance, risk communication, etc. And what does it mean for the for building back better for the NCD prevention and control on the continent? As I said when I started 2 weeks ago, the Africa CDC convened a continental meeting attended by National Public Health Institute directors, Ministry of Health, to validate Africa CDC NCD injuries and mental health strategy for the next 5 years. And the strategy priority are really aligned to the new public health order and focus on the following core areas. Strong public health institution. The strategy really seek to integrate NCD into strengthened public health institution at the continental and national. it really seeks to scale up capacity building for workforce for NCD. It seeks to build on established platform like AVAT, the Africa Vaccine Acquisition Task Force, the AMSP, the Africa Medical Supply Platform for pool procurement and local manufacturing. And it seeks to establish access to sustainable financing and ensure the optimal use, and of course, foster better partnership across sectors to benefit. And so the key message here is the successful investment in cooperation, coordination, collaboration, and communication can be leveraged and adapted to respond to the NCD, including mental health issues. And but let me end by saying that we can't ignore what COVID-19 has taught us so far, and if we use those lessons to translate it into strengthening regional and national institution and system, we can lessen and halt the effect of NCD epidemic on our life and livelihood. Thank you so much, and over to you, Richard.
Thank you very much, Adelard. And again, if I can extend thanks and congratulations to you and your team at Africa CDC. All power to your work. You're a critical actor for the entire continent. Let me turn last but not least to our final speaker of the second panel, and that's Dr. Precious Matsoso. It's really a pleasure to welcome you, Precious. You're going to talk about an extremely topical issue. You are co-chair of the intergovernmental negotiating body to draft and negotiate a WHO convention or an agreement or any other international instrument on pandemic prevention. And you're going to talk to us today about the opportunity that a pandemic treaty might present for those of us working on non-communicable diseases. A very important role you have. Precious, to you. Please.
Hi, Richard. Good to see you, and greetings, and to all panelists and participants. Greetings to all of you. You know, I've listened to all the speakers, and I said I don't have to say much, but listen. It's clear that COVID-19 has brought about the greatest public crisis of our time, and that is a social challenge that requires a more sustainable global architecture and a resilient health system. I think that has been said repeatedly. But the question is, how do we then deal with this deadly interplay of NCDs, COVID, or even it could be other pandemics? But we've also seen over the years, Richard, the colliding epidemics between communicable and non-communicable diseases. But what I think is key is that this health crisis has caused disruptions. We've heard that. There's been assessment. We know that people couldn't access care. But we now sit with, this opportune time and moment to reconfigure a global architecture. But like we did was to go out and request from stakeholders and member states to tell us exactly what is it that must be contained in the instrument. We try to give some guidance in coming up with strategic pillars of equity, governance, and leadership, technical tools and systems, as well as financing. And we are still hopeful because by the time we reached the deadline, response rate was still low. And we were worried, but we extended the deadline, and the final deadline is tomorrow. And this is for both member states and stakeholders, because our approach has been that it's not only government that has the monopoly of ideas. we also need to hear from experts. We need to hear from different institutions and so on. So as we resume our work of identifying substantive elements that must be incorporated, we must also reflect on what is it that must find expression in this instrument? What are those technical issues? And I just, did a review of various attempts to come up with frameworks, conventions. And I zoomed in on NCDs, and I just wanted to share with you and ask you questions rather than respond. Firstly, to say, I mean, how can countries implement so many conventions? It's just not practically possible. And the first one that I think was developed a while ago, and I didn't cite, authors, it was Framework Convention on Alcohol Control, which is aimed at encouraging action on unhealthy alcohol consumption. The second is Convention on Non-Communicable Diseases, which is aimed at encouraging action on non-communicable disease risk factors. The third is Global Nutrition Treaty, which is intended to promote better nutrition and combat malnutrition. Of course, I look at this as undernutrition and overnutrition. And the next one is on obesity. Framework Convention on Obesity Control, which is intended to encourage action on obesity risk factors. And another one is Framework Convention on Global Health, which is aimed at creating a framework of responsibilities on national global health issues. So I've just cited 5. I said, let me just select those that are relevant for NCDs. And my question was, I mean, if I'm sitting in a country trying to implement all of these, how can that be done? So we need one instrument that can integrate all of these in a comprehensive manner. But I also looked at multiple resolutions that have been passed by the World Health Organization, declarations, high-level UN declarations, and all these multiple agreements, frameworks, calls to actions. I think they're important, but how do we see to it that they're implemented? And how do we ensure that there's convergence at the country level? So I tried to come up with some, ideas, but these are also aligned with the NCD Alliance ideas of looking at what are those pillars, so that if you come up with these pillars, at least it can help us as we construct this working draft for purposes of negotiations. We have some ideas of what are these strategic pillars. So the first one on governance, it would be good to look at how we deal with determinants of health, and perhaps look at that thematically and address various issues, whether it be tobacco, alcohol use, unhealthy diet, pollution, insufficient physical activity. So that we don't have these as separate conventions, but all these falling under one instrument. The second is about prevention, a pillar where we deal with prevention as a foundation for pandemic preparedness and response. The third pillar is adequate financing for public health systems so that we can fight health disparities and address inequities, and ensure that we can care for people who are vulnerable, because it's clear that those who are vulnerable were the worst hit by the pandemic. The fourth is to find meaningful community engagement, because we've learned that all these problems start in communities and they end in communities. So if we do not come up with mechanisms by which we can engage communities, I think we've lost the battle. And finally, I think the last two is to remove all these obstacles that undermine access and ensure that we can have a mechanism by which we can facilitate access whilst fostering innovation. And lastly, ensure that we can avoid disruption of NCD services, including screening, diagnosis, routine and palliative care. I know people don't even refer to palliative care, and it's so important, as well as mental health services. So we will be studying all submissions clearly from member states and stakeholders and produce a working draft. But I was just trying to say that we need input, but just looking at multiple frameworks, multiple instruments, you have to start wondering, is it really practical for countries to implement these? So we need something practical, feasible, and easy to implement on the ground. Thank you, Richard, and thank you, panelists and listeners.
Thank you so much, Precious. You've given us a good reality check there. Sometimes we think in too complicated a way about what we need to achieve, and you're right, we need to simplify, simplify, simplify. We've got 10 minutes or so for discussion, and I want to invite all of you to submit questions through the Q&A or chat box, please. But I'm going to start off with one that is really about our tactics. I think we all agree that non-communicable diseases are not just central for global health, but also absolutely vital for thinking through pandemic preparedness. And so I completely understand Precious's point about not overloading countries. So the question I would like to ask the panel is, how do we get NCDs as a higher priority in our pandemic preparedness work, so that they're not forgotten? I noticed Derek Yak, who was on the call earlier, made a very sharp point about Bill Gates's latest book on how to prevent a pandemic. And if you've read the book, he makes many valid points, but he doesn't talk about the importance of non-communicable diseases. And so how do we raise the issue of NCDs in our thinking? Maybe I could start with Bente to give us a view. You're on the front lines of making the case, Bente, and then I could ask Precious for her view as the person who's doing the global coordination work. Bente, you've obviously succeeded in getting NCDs higher up the agenda for the Assembly, but what are your lessons?
I think if I should try to summarize, it's first of all to keep the NCD together. So, you know, everybody's talking about integration, and let's keep the link between the risk factors and the diseases. The moment we are sort of putting this apart, we will lose a lot. And then I think we need to continue the advocacy. It's still a big surprise almost in any country where I'm visiting, that it's 74% of all global deaths and growing. And, you know, when we started to look at diabetes, as was mentioned by Nikolai, I think nobody knew that it was quadrupling and that it was the only major disease that was actually increasing in premature mortality. So on the action side, I think it's especially two things that needs to be done. It's to continue to be super concrete. We need to be relevant. We need to help people that are in crisis. Unless we do that, we are not to trust, to be honest. So I think improve, increase, and do what David says, you know, accelerate. And then it's to use the facts and the data to influence on not 2025, not 2030, but actually 2050. So let's use what we have. So preparation for the next high-level meeting. But we need to make a case almost every day. This is hard work. It will never go away. Sorry to say, no good news on that end, but we are making progress. So I think we can do it.
That's a really interesting and important point, Bente. I mean, this figure of 74%, we've been talking about this figure for many, many years, but it's still a surprise to people. So your point is we can't ever do too little communication. Communication has to be at the center of this.
And it has to be fact-based. If I can add one more thing,
yeah.
I had a very interesting, and this is almost internal, but it's also important. So, I've been working on the DG priority and with colleagues from the health system. And during this journey, they saw what we have seen for many years, that we are living on the sort of hextail of the MDGs. So, we have not been included. We are just being included, even though we are so massive when it comes to the consequences, both for sustainability, economic sustainability, equity, as was mentioned before. So I think also using, the very concrete facts, 100 years after discovering insulin, only 50% actually have a regular supply. How can that be in the sort of century of innovation? So facts, and strong voices working with the people living with. Thank you.
Thanks very much, Bente. So Precious, on the how, what are your observations?
Well, I can talk about our process to say that from the preliminary data that we have, just on these key thematic areas and strategic pillars of equity, leadership and governance, and technical tools and systems, it's quite clear there's convergence. People are agreeing. But what is going to be important is how do we bring these closer? Like Bente in WHO, you have a director for every disease. In a country, you can't afford that. In a facility, a CEO has to manage all of those. So we need to also reprogram globally so that, at the local level, the integration is possible. Because if we can't integrate globally, we're not going to achieve that. So I'm very pleased that you've put, NCDs high on the agenda. But what we would like to see as the Bureau and INB in general is that, the whole process of negotiations is diplomatic, is political. You always find language that is so general. So we would like to really, really find very specific things that we can deliver and make a huge difference. I mean, you can have this broad language, but if we can pick up a few things that are very specific where we can make a huge difference, I think that we would have achieved, a couple of points and milestones. Thank you.
Thanks, Precious. This message is coming through now loud and clear. Be super concrete, be very specific. A few things to recommend that are going to have high impact. So these are very, very clear messages. Adelard, let me just come to you. You're sitting at Africa CDC. Africa CDC has a very, very broad remit. What are your lessons for us about how to elevate the importance of non-communicable diseases within the CDC role?
Yes, thank you so much, Richard. And to respond to that, let me start where my colleague Precious was talking. Looking at the Africa CDC and where it's located, we felt that we cannot address all issue of NCDs, but there is specific areas and what we call in flagship program where we think we can have quick win. And these were really came out strongly during the validation meeting. There's a couple of, I think, 6 priorities that came out strongly that Africa CDC will be focused in the next 5 years. And also on the discussion around the global architecture and versus regional. So let me just say here that equity is also about having strong regional to really help them to tackle, to get the right capacity and capability to tackle those issues. And this is where we brought in the new public health order, which is about having strong national and regional public health institutions. This is very, very important for Africa CDC, where we're talking about equity, but we forget about the regional, architecture, and that's what was really guiding the strategy for Africa CDC. Yeah, thank you.
Thank you very much indeed. Now, I'm going to give a few closing remarks, but I want to just say, is there any issue? I don't want any of you to finish this session without having said all the things you want to say. And I can see Bente's got something she would like to say. So, and Nikolai, that's great. So I'm going to give you get 30 seconds or so to say your final words. Bente.
Going back to specific, so Feng was speaking, what we are trying to do now is a blueprint. So the people on the ground that write up the application for the Global Fund, for the World Bank, that they naturally consider NCD into the proposal, being it COVID, being it humanitarian, or being it for development. That's a very specific way forward, but it needs a vision as well. And then what is the game changer is really what HIV has told us. We need to co-create with people living with NCD, and the one like you are speaking about, Precious, those who implement. Thank you.
Thanks, Bente. Nikolai.
Thank you. I very much agree, Bente, with your comment. I think it's also really important to stress that we have to set targets, and we have to set targets that are reachable, in that sense that we have to hold ourselves accountable, especially the industry. I can say that as being a representative of the pharmaceutical industry. We need targets. We need to measure how we are progressing towards it. And then secondly, I think it's really important that we think about what we can do on the treatment side, but just as importantly, what we can do on the prevention side. I think that's going to be the key to unlock many of these challenges.
Thank you very much. Adelard, would you like to say a final word?
No, I think it's fine. Thank you.
You're okay. And Precious, a final word from you?
My final word is just an appeal. Tomorrow is the last date for submissions. Please submit. Would like to hear from you. What must be contained in the treaty? Thank you.
That's great. Thank you very much indeed. Thank you. Right, so I'm going to just very, very briefly try and sum up. And I'm just going to end with 5 words that I think for me leap out of this discussion. Number 1, urgency. We heard it time and time and time again. There is no time to lose. So we need that sense of immediate action. Number 2, what I just said, specificity. Let's be very clear about what are the concrete actions and recommendations that we're making. None of this vague hand waving, flag waving, advocacy stuff. What are the very specific things we're asking for? Number 3, integration. We are not calling for a new global fund for NCDs. We're not talking about a new vertical program. This is about strengthening the primary healthcare system and having NCDs as an absolutely key part of that. 4th word, accountability. Accountability means measurement. It means monitoring our progress. It means a truly democratic, all of society participatory discussion about progress, and then channeling that discussion and the recommendations that come from that into further political commitment and political action. And a final word, and that is people. We've heard the importance of people mentioned repeatedly. It's in David's paper, the importance of the workforce for delivering this, but we heard it from charity as well, the impact that NCDs have on themselves, but also on the carer, on their carers, on their families. So let's not forget the people here. People are at the center. This is not about non-communicable diseases. This is about people and communities who are living with non-communicable diseases. Let us put a human face on this thing we call NCDs, because it's people at the end of all of this who we are most concerned about. I want to thank our fantastic speakers, the Honourable Minister, Melanie, David, Katie, Feng, Charity, Bente, Nikolai, Adelard, and Precious. You did an amazing job. I want to thank all of you for taking part. And I also want to say that we have a great team of people behind the scenes who made this possible, who you haven't seen, and I want to thank them too. Thanks everybody, wherever you are in the world. Be safe, travel safely, look after yourself, be strong, and I hope we meet again. Thank you so much. Love to all.